Well, good morning. Thank you all for being here as we have the opportunity to enact common sense, bipartisan reforms that help ensure Iowans get the care that they need when and where they need it. I want to start by thanking Monroe County Hospital for hosting us today and for the dedication of its leadership, providers, and staff to this community. It's in buildings like this one that the real work of healthcare takes place. Every day, all across Iowa, healthcare providers are working around the clock to deliver safe, timely, and compassionate care. And House File 2635 supports this mission by removing unnecessary obstacles and helping ensure that medical decisions are driven by clinical judgment and patient needs. One of the most important changes in this bill is the safeguard it creates around the use of AI in utilization review, a process that health insurance companies, hospitals, and other healthcare providers use to ensure that medical services are necessary, appropriate, and cost-effective. While new technologies can help streamline administrative work, this legislation makes it clear that no patient's care can be denied or downgraded by AI alone. A qualified clinician must be involved protecting patients from inappropriate and automated denials and giving providers confidence that their medical decisions will be fairly reviewed. This bill also brings new transparency and predictability to audits and prior authorization. For years, long delays have taken vulnerable time away from patient care. By establishing firm timelines for notifications, decisions, and appeals, insurance companies will now be required to provide clear clinical explanations when care is denied. And this helps providers spend less time navigating red tape and more time with the people they serve. Patients and providers will also benefit from the removal of prior authorization requirements for certain cancer screenings and for emergency care delivered in an inpatient setting. These are moments when time matters and reducing administrative barriers means, patients can get the right care at the right time. The legislation also strengthens prior autonomy by ensuring that referrals, staffing decisions, and clinical judgment are not influenced by insurance contracting pressures. This protects the integrity of the provider-patient relationship and helps ensure care decisions remain grounded in what's best for the patient. And finally, the bill modernizes Iowa's Certificate of Needs system. By updating thresholds and exempting several services, the bill makes it easier for health systems to expand access to behavioral health care, advanced cardiac care, cancer treatment, and other critical services. So altogether, these reforms reduce administrative burden, increase transparency, support clinical decision-making, and expand access to essential services. Most importantly, they strengthen the partnership between providers and patients, helping ensure that healthcare in Iowa remains responsive, patient-centered, and focused on delivering the highest standard of care. So to hear more about the everyday impact this legislation will have for care teams like those here at Monroe County Hospital, I'd like to invite CEO Veronica Foos to say a few words. Veronica?
Thank you, Governor, and welcome to Monroe County Hospital. I'm Veronica Foos. I am the CEO at Monroe County Hospital, and it's truly an honor to host today's bill signing ceremony. On behalf of our board, our providers, the staff, and the patients that we serve every day, thank you for being here. We appreciate the presence of community leaders, hospital staff, and partners who have joined us to mark this important occasion. We are honored to welcome Governor Reynolds and thank you for your leadership, your support for Iowa hospitals, and your ongoing commitment to advancing the health and well-being of Iowans. We extend a warm welcome to Representative Austin Harris, whose leadership and advocacy at the Capitol were instrumental in bringing us to this moment. Thank you for championing this bill and for being a dedicated voice to the people and communities in District 26. The bill Governor Reynolds will sign today, which is HF 2639, represents meaningful progress to advance healthcare in Iowa by putting patients first. This measure will improve patient access to care, reduce administrative barriers so providers can spend more time with patients and less time on paperwork, and reinforce the stability of hospitals that are often the first and sometimes the only point of care for our neighbors. Passage of this bill was unanimous bipartisan support in both the Iowa House and Senate. It is a testament to the tireless advocacy of all of our hospital colleagues throughout the state. On behalf of all Iowa hospitals, thank you to our legislators and Governor Reynolds. The positive impact this bill will be felt directly by patients, families, and caregivers across Iowa.
Thank you, Veronica, and congratulations on receiving a recruitment grant from our Healthy Hometowns Iowa initiative as well. So I'm really excited about the opportunities that that's going to provide for just healthcare throughout rural Iowa. And so all of this really fits together really well, I think, to start to make a big impact moving forward, to build on the good work that you're already doing, but it's meaningful dollars behind what you guys are doing. So I'm excited about that. And just so encouraged by the difference this legislation will make for you, for your providers, and for the patients you serve. And as Veronica said, I also want to thank the legislators who are critical in passing this important bill, especially the floor manager, Senator Warmy and Representative Harris, and also joining us today is Representative David Young. So thank you, Representative, for being here as well. And at this point, because I know this is something that Austin was passionate about, I'd like to give you the opportunity to speak, say a few words.
Absolutely. Thank you very much, Governor. And thank you, everybody, for being here today. And thank you to my colleague, Representative Young, who is the co-author of the bill. And thank you, Veronica, and the Monroe County Hospital for all the great work that you do as well. After 4 years of serving in the Iowa House of Representatives, I have heard countless stories from my constituents about their healthcare experiences. Whether it's patients looking for care or providers trying to provide it, it is unnecessary care has been unnecessarily denied or delayed. So what did we do about it? Well, I'm proud to say that we took on the big insurance companies and we won. The Patients First Act ensures that medical needs of Iowans will be prioritized over the balance sheets of large corporations. This legislation prohibits prior authorizations for cancer screenings, preventive care, and emergency care. It also forces insurance companies to pay providers on time, and it cuts bureaucratic red tape to ensure that doctors can spend more time with their patients instead of pushing paperwork. And when we talk about being able to recruit people into the medical profession here in Iowa, I can't think of a better tool than to tell them that we will get the insurance companies out of their way if they practice here in the state of Iowa. It was also the biggest deregulation of the Certificate of Need program in state history, which will make it much easier for providers like Monroe County to be able to add, expand, and upgrade their services. At the end of the day, this will help lower healthcare costs. It will make it easier for Iowans to access care, and it truly puts the patient first. I'm excited to be able to see this sign today, and thank you for all your work, Governor.
Okay, with that, we're going to sign the bill and make it law. I know, no dog on the table are little kids, you know, wondering why I signed my name like the 4-year-old. Yeah. But they thought it was pretty cool when they got a pen. You know. This might be a permanent marker. Be sure and tell your mother before you use that on anything. Spoken like a true grandma. And mother.
Signature's still better than most of us doctors.